Hey, Dr. Vicky here. So let's talk today about a spinal injury case that I have that came in this past week. And the gentleman had, and I don't know exactly how it all happened, but he fell down an elevator shaft. So we went through most of the details, and he didn't give me everything. So I didn't push for the details. But I did understand the mode of injury, and he actually had something that hit him in the back in his cervical cord. So he had complete not use of his right side, and then he has sensory loss on the same side, temperature, and which is a typical spinal cord pattern. So we went through and we were trying to determine what areas of his nervous system are deficient besides the motor area, because it's clear he's been through physical therapy for quite a while and he's gotten a lot better. He still has a lot of spasms in his hands, and he's a chef and he has a hard time using that left hand. So we came up with a plan. He's here from New York and he's only here until the middle of May. So I have just a few weeks to be able to make some changes. And I treated him a very short treatment on the first visit because we went through his extensive history and that took a long time. So we did some treatments and we saw quite a bit of change in his sensory system. So when he comes back in, we're going to be looking at his motor system more specifically and figuring out if we can charge that by doing some certain therapies. And I've got some things in mind that we're going to do. And I layer those treatments a lot of times. So we have multiple things that we're doing at the same time to charge those areas that are specific. Sometimes we have to go through the back way. It's kind of like going through the back door of the house instead of the front door, because they don't lack the integrity to be able to withstand a treatment that's going to be a high level treatment, such as a cervical adjustment or something that is going to be a lot of integration into the brain. And we want to make sure that we don't set him back, because that can raise your autonomic nervous system, which is what we monitor with cases like this. So I'm excited to see where we can go with this. And we made quite a bit of change in one visit and only 15 minutes of treatment. So I was pretty stoked about that. So if you have a difficult case, a neurological case that you're not really seeing great results, give me a call at 303-385-3432, or you can go and set up an appointment at souterchiropractic.com.